Michelle and Dr. Workman are in the far corner behind Mitch, which is a place I don't know why you'd want to be.
That's a fabulous place to be.
But Michelle is about to... Dr. Workman, what are you doing? Are you putting protective lenses
Nelly.
on? And he's got his camera out. Come on up to Mitch's mic for a minute.
Okay.
So what were you saying in the hallway about your fraternity and fear of needles?
Oh, I have a needle phobia. I've had it ever since I was 18 when, as a pledge at the ATO fraternity, we had to take a 1/4-inch wide needle, put it inside our elbow for 2 hours, and donate plasma.
No.
Oh, so it's called a blood drive.
It's called a blood drive.
You made this sound like it was some sort of like medieval fraternity torture that we had. It was a blood drive. So tell us, Dr. Robinson, what is going to happen here?
Well, Botox, we've talked about it before. Botox basically weakens certain muscle groups, and there's certain wrinkled areas on Michael's face that he wants to smooth out a little bit. So Michelle he's going to sit down in the chair. Dr. Mark Workman has put on some topical anesthetic, which is an option for some patients if they want to sort of dull the little minor needle stick that occurs.
For the pansies.
Right, for those, people who can't handle it.
The needle is so tiny. It's much different than even like a flu shot, isn't it?
It's actually smaller than a 30-gauge needle, which is a very small needle.
Wow.
We use 32-gauge needles.
And what it does is it paralyzes a very, very minute specific area.
Very localized area and very controlled. And Michelle's very good at this. And she's... right now, wiping off with some
God,
alcohol.
look at how you can see your heart beating from here.
Thank God I have CPR training. Everyone's going to be fine.
You know where the defibrillator is.
He has his fingers clenched to where not only the knuckle, but the entire fingers are white. And he's leaning back right now. He looks like my son at the dentist. Any minute now, he's going to start screaming and saying, I want my toy monkey.
Michelle right now is asking him to constrict and do the facial musculature.
Basically. Frown really hard so she can see where the lines are.
The glabellar muscles that make the vertical frown lines between the eyebrows.
Dumb it down, Doc. You mean the 11s, the 11s between the eyebrows that a lot of people have when they frown. Right. Now she's positioning the needle. The great, big, giant, boar-like needle.
That 1/4-inch plasma sucking needle they're putting in his forehead. No, actually, very small.
He's singing a song.
I just accidentally looked at that.
Going on. That's okay. People can do that if they want.
Okay, let's be quiet and listen.
You should hold my hand. You have no idea.
It doesn't hurt.
See? So
you don't even feel it.
She has just finished. See, that took, 15 seconds?
Right.
She's basically done with the injection.
Beautiful.
So how long will...
That's how hard it is.
How long will what she just did take to take effect?
It's anywhere with Botox, 6 to 8 days up to maybe 12 to 14 days. It's extremely variable, but it's probably averages 9 to 12 days.
And it's something that comes on gradually. So when you first have it done, you won't really notice any difference whatsoever, and you'll be like, oh.
Yeah, you can't expect to have a Botox injection done and then have the wrinkle that you are injecting be relaxed.
But then,
that night.
5, 6, 7, 8 days later, you look in the mirror and you're like, oh my gosh.
And it's not like what you see like in sketches like on SNL and stuff like that. You have movement in your forehead.
Absolutely.
You can move your eyebrows.
You would have to get...
what you do is...
You would have to get like 150 shots of Botox to make that happen.
Right, like Gary Shanley.
Like Gary Shanley.
Right, exactly.
It sounds quite dramatic, but it's really only because we're injecting Dr. Workman.
Yeah. Some people like to make it real dramatic. Where on the face are the most common places and most effective places for people to get Botox?
Would be in the glabella, which is between the eyebrows, the vertical lines between the eyebrows.
Yep.
The crow's feet, out lateral to the eyes.
What about the horizontal lines in the forehead?
To a certain extent, you can put a few units in there to sort of semi-weaken it. You don't want to totally paralyze the whole forehead because then the brow will drop a little bit.
Right.
I've heard also, Dr. Robinson, folks that have very gummy smiles, that you smile and you see a lot of gum, not so much teeth.
You can inject that. It does alter mobility around the lip a little bit, and you can get some very, very slight changes in pronunciation. And obviously for radio people, you wouldn't be doing that. But,
no.
But put this downstairs.
So
what? Okay, that is
what just happened to
put it
He's talking about how he says, which is a lie, that his beautiful wife wanted him to put the lidocaine lidocaine numbing agent somewhere down below.
Well, there you go.
He's just giddy as a little
Carol,
girl.
if you're listening, I apologize on behalf of your completely whacked out husband right now.
But it's all drugs. It's seriously.
Botox cream. Can you imagine waking up
No.
limp for a month?
Stop. We're still on the radio, Dr. Workman, and you're still a doctor.
Oh, my God. I don't think that translated enough. We better take a break.
We should.
When we come back, we're going to talk more to Michelle and find out what some of the really simple, easy things that you can do to fairly dramatically change the appearance and youthfulness of your face.